Hello, and welcome again to another episode from our series on CYC MD. Every time we meet with different healthcare professionals who provide us with tips and insights on their focused area of practice. Today, we will be focusing on how to show off your beautiful smile by showing your teeth. Today, I'd like to welcome our dentist and my friend also, Dr. Shady Samuel.
Thank you. Thank you very much for having me. And yes, we are going to show off teeth today and how to get those nice pearly whites.
Whoa! I'm really excited about this, and there's so many questions that our viewers also sent us, and I know teeth are always a big factor in people, whether it comes to appearance, and people always care so much on their teeth, and they invest. It's actually an investment in a lot of money.
Absolutely.
And so, but before we actually get into that, if you don't mind, we just talk about your education for a little bit. Where did you graduate from?
So I went for my undergrad training at St. John's University in Queens, New York, and then I did my professional dental school training at University at Buffalo in Buffalo. And each was 4 years undergraduate and 4 years graduate. And currently I'm doing my residency specializing in pediatric dentistry at Staten Island University Hospital. And that's a 2-year program.
So that would be a total of 10 years once you are completed, actually.
Please don't remind me, but yes.
But you're there,
yes.
Home stretch is there.
Home stretch, absolutely, home stretch.
That's good, that's great, actually.
Thank you.
I know it seems probably like, when you look back to your undergrad years,
Absolutely.
You're probably thinking like, okay, 10 years, that's never going to be over.
Absolutely.
But looking back,
we're towards the end.
And you feel good about the accomplishments.
Yep.
Great.
Thank you.
And you said you're currently working where?
I'm currently doing my residency, my specialty training at Staten Island University Hospital. It's a North Shore hospital. And
what do you like most about your job?
That's a very good question. I am happy to be able to say that I go to work and the time passes by well because I enjoy what I'm doing. Especially now that I'm working with children, it's a whole different level, I feel, of dentistry, just because it's more of kind of entertaining the kids and doing distraction and just being kind of more finesse with what you're doing. Kids, obviously, a lot of kids are very scared of the dentist just from maybe something they've seen on TV or just the thought of work. So there's a lot,
the drills.
Absolutely. So there's a lot of kind of desensitization that we do to make sure that their experience is as positive as possible, because I personally feel that when you have a good experience, they'll be able to continue keep up with their teeth. They'll come in for their checkups. Therefore, if there's a cavity, we're able to catch it earlier before it becomes a big ordeal, such as root canals, which I'm sure we'll get into in a little bit. So it really all starts when they're young with good influences, and them having good time, I guess,
with their dentist. Yeah. Why did you choose the career of a dentist?
I found it, I'm a very hands-on, for people who know me, I love working with my hands. I love trying to kind of fix stuff and, really using my hands to do what I want to do. So, and I've always wanted to be in the health professional and give back and help people. So it made sense for me. It just worked out, and I love what I do. And
that's great. Because if you really don't love what you do,
Absolutely.
to wake up every day and not love what you do
Absolutely.
is not great.
Absolutely.
We know that.
Absolutely.
I mean, I'm a pharmacist, and to wake up,
Absolutely.
and I love what I do, and it's so rewarding
Absolutely.
It's really rewarding to know that I wake up to something I love to do, and I come home,
Correct.
and it's great.
Correct.
What would you say is most challenging in your profession?
I'll speak again specifically of pediatric generation. Obviously,
okay.
There's a lot of techniques that can be very challenging, but with pediatrics, if a kid is not cooperative, if he's just worried about it and just moving all over the place, you could imagine trying to do any dentistry on someone whose head's moving all over like this. It could be very dangerous for the patient.
Yeah.
Could be very dangerous for the doctor, for the assistant. So that's probably the most challenging part, but that's why we invest a lot of time building the trust
From a young age.
Exactly, building the trust from the young age so that it's just a matter of the procedure after that.
So they're very fidgety, you're saying,
Absolutely.
in a sense that you can't even, get the task done.
Correct, correct.
So getting into general hygiene questions.
Excellent.
How many times a day and when are we supposed to brush our teeth?
Beautiful question. Actually, I have a model of a set of teeth over here, so I'll just take a step back just to kind of briefly explain the different teeth and
Yes,
and
please.
their functions. We have in the front, our front teeth are called the incisors. Those include the 4 front teeth, top and bottom. They're incisors. Then we have a canine, which are the eye teeth. And then we have premolars. We have 2 premolars, and then we have 3 molars. And what I'm saying includes all the sides. So again, from the beginning, incisor, incisor, canine, premolar, premolar, molar, molar, and there's normally 1 more molar at the back. Those are called your wisdom teeth. So this is a model of of adult teeth. With a pediatric young children's teeth, there's different, they have smaller teeth. Those baby teeth fall out and they get replaced by these adult teeth. So we'll just use this as an example for now. You need to make sure when you're brushing your teeth, obviously I have a toothpaste, and obviously you're going to put some I have a toothbrush and we're going to put some toothpaste on it. Mm-hmm. When you're brushing, you want to make sure to be going in circular motions, and you do not want to be putting lots of pressure. If you're putting lots of pressure, what you're doing, you may be doing a very good job cleaning the teeth, but you're actually hurting the gums just because of that aggressive type of motion. So you want to be going in a circular motion, again, in a gentle brushing habit. You want to make sure you brush the fronts of the teeth. You want to make sure you brush the tops of the teeth, up and down, of course. And you want to make sure you brush the inside. So that might mean you have to angle the toothbrush to get all the inside, top and bottom. Okay? So it does take some time to do a good brush, but it's definitely worth it, because the thing with dentistry is it's very preventable just with some good habits when you're younger. Along with brushing your teeth, you also have your tongue. You want to brush your tongue because that's what collects the odor that sometimes people complain that they have a bad taste in their mouth. If you're not brushing your teeth, that's collecting all the food that you're eating. And flossing. Now, we did a very good job brushing the front, top, side, everything, but the one thing that we can't get to with a toothbrush is in between the teeth. A toothbrush is too big to be able to get in between, and that's why we have flossing. And it's very important to floss because cavities start normally in between the teeth. So very important you floss, because that's how you're cleaning in between the teeth along with brushing. So that's just a quick demonstration.
Mm-hmm. Wow. Thank you for that.
You're welcome.
And how many times a day do you brush
I'm sorry, yes, you did ask that. You want to brush 2 to 3 times a day. You want to brush in the morning, and you want to make sure you brush before you go to sleep. If you're able to squeeze a third one in there, that's definitely recommendable. Again, in the morning is to start off nice and fresh, and at night you want to clean off any food, any particles, any debris that's on your teeth before you sleep, and therefore those debris sitting on your teeth all through the night.
And if you were to recommend a third time, when would that be?
After lunch, possibly.
After lunch.
Again,
well, after lunch, I would say maybe a little difficult.
I agree, and that's why we say 2 times a day.
Okay.
Some people, and it's great, some people are very strong and strong-willed and can do after lunch, but for the general population, 2 times a day is very good.
Mm. Now, we know there's so many kinds of toothpaste that are on the market, whether it's Colgate, Crest, and then each one has their own, whether it's cavity protectant, ultra white, max 3D, and they start being so creative.
Absolutely.
What is the difference, and what do we need? Like when I go to the store and I see all these, it's like rows and rows and rows of toothpaste. How do I know which one to get?
Correct. Well, there are many different toothpaste for many different small kind of problems you may have. For example, a toothpaste may be very strong in fluoride, and what fluoride does is it helps keep the teeth nice and strong. Another toothpaste may have a whitening additive to it to help kind of whiten your teeth a little bit. Mm-hmm. Another toothpaste might have a desensitizing gel included in the toothbrush for people who complain of sensitive teeth. So again, but none of these are going to work if we're not brushing our teeth. So the most important thing is to brush and use toothpaste. Then if you want to whiten a little bit, you could pick something that has whitening, peroxide in it. If you want to something fluoride, it may strengthen your teeth. If your teeth are sensitive, again, but the most important thing is to use the toothpaste.
Okay, but it really doesn't, you're saying it doesn't really matter unless you have like certain
Specific concerns.
So if you have a cavity that I'm worried about, I probably want to use that cavity protectant.
Correct, but again, if the cavity isn't, if you already have a cavity, that's not going to do anything.
Okay.
A cavity protectant will minimize the chance of you getting a
the
cavity, but
cavity.
if you've gotten a cavity already, there's no way that a toothpaste would help with that.
Would help, okay. I know many times, I mean, I'm guilty of this, that I only see in general, whether it comes to doctors or dentists. I mean, I only go to a doctor if I'm not feeling well. I'll only visit a dentist when I start getting that toothache or whatever, some problem that's in my, teeth, and teeth problems, whoever has experienced it, we know it's painful.
Absolutely.
To have like a toothache, to have a loose tooth, whatever it may be. So how many times a year, we'll just say that, for a normal person who doesn't really feel any pain to visit their dentist, would you say would be appropriate, like an appropriate number?
We recommend 2 visits a year, so every 6 months for a checkup and a cleaning. And it's obviously not wise to wait for pain to come to the dentist, because what that means is that a cavity that was very small, because everything starts small. So
Yes,
a cavity that was very small, that if we would have been going for regular checkups, the dentist would have caught it nice and early. We would have done a very nice, simple restoration filling, and that would have been it. But because it's grown, and now grown to the point where it's bothering you, that means the cavity has really taken up a majority of the tooth. Okay, which means that now we're talking root canals and more in-depth procedures to save that tooth. As compared to if you were visiting the dentist every 6 months, you'd get a cleaning, the dentist would be able to maybe tell you, oh, you do a little bit better job brushing over here, and would obviously catch problems right in the beginning where they're very easily to be saved. So twice a year for a deep, it's a cleaning. Obviously you have to brush, but also this cleaning that we do goes underneath the gums. And again, with the x-rays are taken to check for cavities early, and then obviously a whole bunch of other stuff.
Yes. Now again, another question that one of our viewers asked was, there's so many crest whitening or whitening products that are on the market. How effective is the whitening strips that one person may want to use?
Correct. Over-the-counter strips would be effective. Normally they say it'll lighten your teeth maybe 2 to 3 shades. So it really comes down to how much whitening are you interested in. The percentage of hydrogen peroxide that are contained in the whitening strips is a less percentage when you buy them over the counter as compared to when you have dentists make you specific trays and give you the peroxide, which is more concentrated. So the whitening is correlated with the strength of the peroxide. And over the counter is only a certain percentage of peroxide that's allowed, and therefore only a certain whitening. If you want anything more than that, it would have to be done through your dentist. But a lot of people are satisfied maybe with just, oh, I just like to whiten up a little bit, and they find the strips to work very well. The thing with the strips, they're not made specifically for you, so one of the main complaints is that they move all over the place and the gel doesn't stay, which would be the advantage of having whitening done at a dentist, because they'll make specific trays actually custom to your teeth. Exactly.
And would you say that the strips are, I want to say, do you think they're safe for your teeth?
Yes, they are safe. Again, some people may complain of sensitive teeth, and that's maybe from over whitening. Normally, the over-the-counter hydrogen peroxide concentration is not that strong, so you won't really have that sensitivity issue. Some people may have it because they may have gum disease involved or other stuff in the mixture. But for the most part, people who are interested in just kind of a lightening, the whitening strips do a good job. Anything more than that, you'd need more work.
And how long do these would it last for? Or would it last for a while?
It all really comes down to your diet and your habits. If you're drinking lots of coffee or lots of soda, these are all what
Things that
stain
stains
the
your teeth.
Exactly.
They always
So
say that.
two people could do the same exact thing. One person is drinking lots of coffee and tea and anything else, soda, and somebody doesn't. So it's just going to depend
Comes
on
to
that.
like your lifestyle.
Correct.
So again, we talked about toothaches being probably the number one reason patients might want to see their dentist. What are reasons that cause for a toothache?
Perfect. So the outer, when you see someone's teeth, there's an outer white called enamel. Underneath the enamel, there's a kind of a yellowish, that you don't see that when you're looking at someone, but just the tooth structure. Underneath that, there's a kind of a yellowish dentin. And then deep inside is the nerve, the pulp of the tooth. Every tooth has a nerve. The reason why people have discomfort in their teeth is if a cavity went through the enamel, through the dentin, and now is into the nerve or very close to the nerve of the tooth. And that's why, because it's a nerve, you have that discomfort. And again, that's why we like to catch cavities when they're still in enamel or enamel and dentin before it gets into the pulp. Once a cavity has reached into the pulp, the nerve of the tooth, or even very close to it, then the tooth needs a root canal to be able to be saved. And what a root canal basically does is it removes the nerve of the tooth so that it doesn't bother you anymore. Sometimes if the cavity is so big where there's very little tooth structure left, unfortunately the tooth will have to be extracted, mean taken out. We don't like to do that because obviously my teeth are very important to me, as I'm sure they are to everyone else. So we try our best to save whatever teeth that we have. But again, if the cavity is so big and there's very little tooth structure left, the tooth will need to be taken out. If it's into the nerve, a root canal will need to be done. And again, if it's into the enamel or dentin, a nice filling will do.
Now, is it, I always hear people saying that maybe sometimes, again, like fact or myth, if one of my teeth have a cavity and it develops, can it actually affect the neighboring teeth?
Absolutely. That's absolutely. Especially when I was explaining earlier with brushing and flossing, if a cavity starts in between, guess what? There are two teeth right there. So we'll see a lot of times if a cavity is in between, it's on both teeth. So yes.
Now, in regards to even flossing, I know you mentioned it what can we use to floss?
Floss is basically a thread, a very, very thin thread. And what you do is you'll roll it on 2 fingers and you just place it in between the teeth very gently. You do not want to snap it in hard because that might hurt your gums.
So you mean like the thread that you use to even for sewing?
No, there's specific floss
you have
that
to get, because I know people use, sometimes they'll use anything.
I mean, that's not
but
the most ideal.
But you recommend
Correct.
to just go, like if you go to a store,
Correct.
whatever neighboring pharmacy or
Correct.
whatever, they'll have the
Absolutely.
floss that
The
you
floss,
can use.
Correct. And it comes in a nice, small, easy to carry box, and you just take a piece like this and you go in between all your teeth to make sure you clean everything.
And what if you start bleeding?
It's very normal for someone to start bleeding once you initially start flossing, but what that means is that your gums are inflamed, meaning there is a little inflammation in the area. So once the floss has touched those gums, it stimulates the tissue, and that's why you get a little bit of bleeding. Once you start flossing regularly, that bleeding stops altogether because now the gum is nice and healthy.
Okay, so you shouldn't be scared in the beginning.
You shouldn't
when
be.
you see the blood.
Correct.
Just rinse it out, and
Correct.
it'll eventually, of course, the blood will
Correct.
it'll stop bleeding. Your gums will heal.
Correct.
And then you'll have nice and healthy gums.
Absolutely.
And healthy gums allow for also healthy teeth.
Absolutely, because gums, underneath the gums is the bone that holds the teeth. If the gums are unhealthy, the gums start receding, they start shrinking, and therefore the bone starts shrinking, and therefore the support that you've had for the teeth starts shrinking. So before you know, your teeth start getting loose, and that's how people end up losing their teeth prematurely because they're not anchored in the bone anymore.
Now, I know we use the word cavity a lot in the past few minutes. What is a cavity, and how does a cavity even develop?
Good. A cavity is when there is a break in the tooth structure. If you could imagine you're eating candy and you sleep at night without brushing your teeth. You have a
That would
lot
be like
amount
the number
of
one cause for little kids
absolutely,
to
and
develop.
believe it or not, also sodas are very concentrated in sugar. A lot of parents may think apple juice is good for the kids, but if you look at the ingredients, it's a very strong amount of concentrated sugar. So what's happening? The sugar sits on the teeth, and basically it's a fight. The sugar fights the tooth. Who ends up winning? If you're brushing, flossing, doing everything good, you got rid of the sugar, your teeth wins. If the sugar is just sitting on the teeth, with time it starts eating away, and then you get a cavity. So very easily preventable, but again, poor hygiene or poor habits will lead to lots of cavities.
So a cavity, in short, is basically an opening that's in your teeth. And
Destruction, correct.
Right, and once that opening is there, it allows also for other, things, whether it's food and anything to also rest there.
Correct.
Which
Progresses and just makes it even further. Once you have an opening, there's nothing that can be, you can't do anything. You need a filling or you need some kind of work, or else it just keeps progressing, gets bigger, and guess what? Ends up bothering you, and that's when you end up coming, and that's why, unfortunately, then we say, sorry, cavity is too big, or it needs a root canal, and so on and so forth.
Thank you so much, Dr. Shady. It was a pleasure to have you.
Thank you for having me.
It was a pleasure. We learned so much, and I hope our viewers also learned so much. And if they were brushing their teeth wrong, which I sure was, because I would always go just so now we know it's a circular motion.
Correct.
And we're not going to sleep with candy in our mouth. Don't sleep with candy in your mouth. But it was a pleasure to have you, and I know you're going to be back with us shortly.
Awesome. Thank you for having me again.
So we hope you enjoyed our episode today on CYC MD. We will return with Dr. Shady on another episode, and we will be talking more about cavities, braces, root canals, and many more topics that may interest you. So stay tuned. You don't want to miss it. Until next time, God bless.